Hello. Today we'll be dealing on some questions for those that are preparing for pre-councils and also for council examination. So we'll run through questions and answers, and I'll give you some rationale concerning some answers. So we'll begin today with infection prevention and control. You know, National Midwifery Council curriculum, they have different subheadings. So we are starting with infection prevention and control. Infection prevention and control, IPC. They are just methods, practices, or ways that healthcare professionals in a healthcare setting use in order to prevent the spread of infection. They use it to protect themselves, they use it to protect the patient, they use it to protect the visitors that come to visit the patient. So we'll be running through 40 questions. So let's start. Question 1. Question 1 says, which of the following is the single most effective method of preventing the spread of infection in the hospital? Preventing the spread of infection in the hospital. When you see a question, there are keywords. The keyword here is single most effective. Preventing the spread of infection in the hospital. Preventing the spread of infection in the hospital is IPC. They now said which of them is the single and most effective way. A. Wearing of glove. B. Hand hygiene. C. Apron. D. Face masks. They are all ways you use to prevent infection. But the one that is the single and most effective is hand hygiene, or you say hand washing. Why? Because when you wear glove, you pull off your glove, you must wash your hand. You pull off your apron, you must wash your hand. You discard your face mask, you must wash your hand. Anything you do, you must wash your hand. And when you wash your hand, you've reduced more than 50% of infection from yourself and from patients. So washing of hand is the single most effective way to prevent spread of infection. Question 2. They say the causative organism of tuberculosis is causative organisms, the organism that causes a particular disease. They say which one causes tuberculosis? From the option, you see that is C, because it's stated there already. Mycobacterium tuberculosis. That is the causative organism of tuberculosis. Option A, Streptococcus aureus. They are bacteria. They normally affect wound, cause abscess, they can cause boil, etc. Escherichia coli, E. coli, the one you find in your guts, in your stomach and in your intestine. In severe cases, they can actually cause food poisoning. Then D, Streptococcus pneumoniae. You've seen it there, pneumo. You know it causes pneumonia. So when you see options, try to rule out the odd ones and try to see the one that is similar to the question. Question 3. They say which of the following is an example of medical asepsis? Example of medical asepsis. Asepsis are ways that you use to reduce or eradicate microorganisms and their spores. Reduce or eradicate microorganisms and their spores. That's asepsis. There is medical and there is surgical. Medical asepsis, they reduce microorganisms. They reduce the spread of microorganisms. While surgical, they eliminate all the microorganisms and their spores. So that's the difference between medical and surgical. Medical reduces microorganisms, surgical kills them completely. From the option A, B, C, D. A says surgical hand scrub. They've already put surgical there, so you know it's surgical asepsis. B, sterile dressing. Sterile is surgical. C, routine hand washing. Routine hand washing is also called medical hand washing. So it's different from scrubbing, which is surgical hand washing. So the answer is C. D, sterilizing. They've already put sterilizing there. Anything sterilizing, anything sterile, anything surgical is surgical asepsis. So the answer to this question, medical asepsis, is routine hand washing. Question 4. Which sterilization method is most appropriate for surgical instruments? Before autoclaving, they used to boil, they used to do other things. It kills the bacteria, but it does not kill all the bacteria. but it's still better than just normal washing. But when autoclaving came, autoclaving will kill the bacteria, it will kill their spores and everything. The thing will be 100% pure. So sterilization method that is most effective for surgical instruments is autoclaving. Boiling can kill, but may not kill all, and it will not kill their spores. Sun drying, when you dry under the sun, yes, it can kill some, but it cannot kill everything because the sun is not hot enough. Normal washing with soap is medical, so that one is even excluded. Your answer is down B, autoclaving. Because autoclaving not just kills the microorganisms, it kills their spores too, destroys it completely. The method of sterilization that is most effective for surgical instruments, surgical drape, surgical, everything surgical is autoclaving. Next question, question 5. Which personal protective equipment should be worn when there is a risk of contact with blood? Personal protective equipment, PPE. That's personal protective equipment. Hand gloves, your goggles, your shoes, your apron, your cap, etc. They're all PPE. They now say which one should you use when there is risk with contact with blood? The answer is gloves. When there is a risk of contact with blood, you use your hand glove. When the risk, you want to protect your skin, you use your hand glove. If you are protecting your body, you use apron. You want to protect your eyes, you use your goggles or you use your face shield. You want to protect your head, you use your helmet, your leg, you use your boots. So contact with blood, or they say you want to protect your skin, you use hand gloves. So the answer to that question, risk of contact with blood, is hand glove. Could be sterile depending on what you are doing, or normal latex glove, medical hand glove. Question 6. Incubation period is the time between A, exposure to an organism and onset of symptoms, B, diagnosis and treatment, C, recovery and discharge, D, admission or surgery. A is the answer. When they say incubation period is the period that the susceptible human or susceptible organism gets in contact with the microorganism and when the first signs and symptoms appear. For example, incubation period for malaria is 3 to 7 days. When you come in contact with mosquito that has plasmodium, the plasmodium is the organism that causes malaria, and mosquitoes are the ones that carry it around. So the first time or the first day that mosquito that has plasmodium beats you, from that day till the day you now start having fever, etc., is the incubation period. So the day you are exposed to the microorganism and the onset of the first signs and symptoms is incubation period. So that, if they can say incubation period for malaria is how many days? 3 to 7 days. So each disease has their different incubation period. So question 7 is which is not a link in the chain of infection? Which is not a link in the chain of infection? Chain of infection has 6 links. One of my videos that I posted in Instagram and other places, I've talked about chain of infection. Chain of infection, there are 6 in number. And you should know the sequence because it does not change. It just remains like that. It's like a fact. It's just like that from up to down. There are 6. The first one is the microorganism themselves, which is A, infectious agents. That's 1. 2 is the reservoir. The reservoir is like their house where they stay. That is the number 2. Number 3 is their portal of exits. How do they leave this their house? Number 4 is mode of transmission. How are they carried when they leave their house? How are they carried from one place to another? Number 5, mode or portal of entering. How do they enter this human being that is susceptible, or even those that are not susceptible? How does it enter? Then number 6 is the susceptible human themselves. So that's the sixth chain of infection, or the 6 links in the chain of infection: the microorganism itself, the reservoir, portal of exit, mode of transmission, portal of entry, and the susceptible host. So what are the examples of the links of the chain of infection? 1. When they say the microorganism or the infectious agent, example, virus, bacteria, protozoa, etc. Reservoir, which is the house they stay, they can be in human, they can be in animal, they can be in soil. Portal of exit, how do they leave this place? They could leave through poo, that's fecal, they'll poo, they leave, they cough, you sneeze, or through blood. Those are portal of exit. Mode of transmission, it means how are they transmitted? After you've sneezed it, you can say it's airborne, they can say droplets, they can say through contact with one another, like the sexually transmitted. Then portal of entry, how does it enter this body? Can enter through broken skin, can enter through your eyes, through your nose, through your mouth, etc. When they say mouth, it means fecal oral. You eat through the mouth. Then the susceptible hosts, those are hosts that have low immunity. They have low immunity, so once they come in contact with this microorganism, they will get sick. And IPC is trying to break this chain. So your question says, which is not a link in the chain of infection? Infectious agent is there, mode of transmission is there, blood pressure is not there, susceptible host is there. So your answer is blood pressure. Blood pressure is not a link to the chain of infection. Our next question, question 8. The nurse should wash hand for at least how many seconds? You should wash your hand for at least 20 seconds. 20 seconds is actually not a long time. But there are some people that actually wash their hand for less than 20 seconds. They'll just go put on the tap. They are out. Within 10 seconds, they are out. But it should be at least 20 seconds. At least 20 seconds. Question 9. Which isolation is recommended for pulmonary tuberculosis? Which isolation is recommended for tuberculosis, pulmonary tuberculosis? Isolation is the process of separating a sick person from others so that they will not affect that person. When they say isolation, it means the person is sick already. It's different from quarantine. Quarantine, the people they were exposed to an infection, but they don't have symptoms yet. That's quarantine. But isolation, there is a symptom already. So you want to separate this person from others that are healthy. That's isolation. There are different types of isolation. Contact isolation, that's you are separating one person from another, because when you get in contact with this person, either through blood or just normal contact, you can get infected. That's contact isolation. Airborne isolation is when you isolate a sick person that can transmit infection through droplets. It's like tiny particles. Tiny particles. Like when you sneeze. You know when you sneeze, the particles that comes out is there. They are like vapor. So that one is airborne. Tuberculosis is airborne. So isolation you use for patients with pulmonary tuberculosis is airborne isolation. There's also another isolation called droplet isolation. It's similar to airborne because they are both inhalation. You know, anything through the nose is inhalation. Then protective isolation. Protective isolation is when this person is very weak, people that are susceptible, people that have a weak immune system, or they have 1 or 2 infections like that, not infection, 1 or 2 disorders that makes them have low immunity. So you want to protect this person from outside world. That one is protective isolation. So you place this patient maybe in a house or whatever, in a healthcare setting, and you prevent this person from going out. Protect this person from outside world. That's protective isolation. Then enteric isolation, etc. So your answer is airborne isolation for pulmonary tuberculosis. Question 10. Which color-coded waste bin is commonly used for infectious waste? One of my videos that I also posted on one of my handles, I think all of the handles, I also explain the different color code for different infectious and non-infectious wastes. In hospitals, you don't just create infectious waste, you also create biohazard waste, even non-infectious, like when somebody finish eating now, the pack is non-infectious. So which color code bin should you put that one? Non-infectious is black. This infectious they are talking about is yellow. Infectious waste, you put them in yellow bin. Sharps, you put them in white. That's your normal safety box. They are always white for sharps. You put them in white. Infectious, yellow. Non-infectious, normal disposable, your nylon you used to eat, pure water pack, the etc. you use black. Biohazards, all those chemicals and the rest, you use red, etc. Question 11. They say the first step in proper hand washing is to what? When they ask you first step, the first thing you should do in proper hand washing. For example, when they ask you to take patient's blood pressure and they say what is the first thing you should do when you want to take a patient's blood pressure? Some people may say, when I go there, I'll confirm the patient's name and the rest. Or some may say, when I go there, I will check this FIG or patient's case note, this one, that one. But the first thing you should do when you want to check a patient's blood pressure is to greet the patient. That's the first thing. Even your procedure manual, it's there. You must greet the patient, you must explain procedure to the patient before you take consent. Before you go and even collect your SPIG and the rest, or if you went there with your SPIG, is it actually better you go and explain to the patient, take consent before you go and carry your SPIG? So what's the first thing you must do when you want to do normal hand washing? They say A, dry the hands, B, apply soap, C, wet the hands with clean running water, D, wear gloves. All these ones not the answer, it's obvious. You must wet the hand, you must wash your hand. You must wet it first under running water. So you put on the tap, or if it's surgical, somebody will put the tap on for you. Then you wet your hand. After wetting your hand, that's when you apply soap. You don't just put soap before you put hand under the sink. You must wet the hand first before applying soap. So the first step in proper hand washing is for you to wet your hand. Next question, which is an example of healthcare associated infection? Healthcare associated infection. Healthcare associated infection is also called nosocomial infection. It's also called hospital acquired infection. When they say hospital acquired, it means you got it from the hospital. You didn't go with it. Healthcare associated infection, infection you get from a healthcare system. Nosocomial infection is still a name they give to healthcare associated infection. So anywhere you see healthcare associated infection, nosocomial infection, hospital acquired infection, they are talking about the same thing. Your option said malaria acquired at home. They already put at home there. You can also acquire malaria in the hospital, because some people stay for more than 3 days, some people stay for more than 1 week. And all those patients that are infected with malaria and the rest, mosquito will go and bite them, carry the plasmodium, will go and transmit to another person that does not have malaria. That's why most times they try to reduce your stay in the hospital. Not because of anything, but because of all this hospital-acquired infection. So malaria you got at home is not. Typhoid before admission is not. Catheter-associated urinary tract infection, yes. Catheter-associated urinary tract infection is UTI you get as a result of catheterization, and you are catheterized in the hospital, which means C is the answer. This is a common cold before hospital. Anything before hospital admission or before presentation to the hospital is not hospital acquired. You see the name, hospital acquired, healthcare associated. It means you got it from the hospital or during your healthcare or during your visit to the hospital. Those are healthcare-associated infection or nosocomial infection or hospital-acquired infection. Number 13. Which microorganism commonly causes wound infection? Which microorganism commonly causes wound infection? Streptococcus aureus. I told you Streptococcus aureus before, that it causes abscess, it causes boil, and etc. So Streptococcus is the answer. Vibrio cholerae. You already see the name there, cholera. Plasmodium falciparum, Plasmodium, malaria. Hepatitis A virus, hepatitis A. Hepatitis B virus is B, C is C, D is D. So, which one causes wound infection? A causes wound infection. 14. Sterile gloves are required for A. Feeding a patient, B. Taking blood pressure, C. Assisting in sterile procedure, D. Making a patient's bed. Sterile should be for sterile procedures. Assisting in a sterile procedures. If you want to feed patient, take blood pressure, or make bed, you use normal latex glove for that. Because what you are doing is a clean procedure and not a sterile procedure. In hospitals, you have clean procedures, which are the medical asepsis, sterile procedures, which are the surgical asepsis. Next question, 15. Which is the best example of standard precaution? Standard precaution. A. They said apply precautions only to infected patients. B. Treat all and everything as infectious. C. Wearing of gloves. D. Isolate every patient. You cannot isolate every patient. Yes, wearing gloves only in theater. You wear gloves all the time. Apply precaution only to infected patients. No, because when a patient comes in, you don't know those are infected or those are not infected. It's after observation, after investigations that you will know. So you treat all blood, all body fluid, all patients as potentially infectious. Everybody, treat them as potentially infectious. So your answer is B. Standard precaution says treat everybody, every blood fluid, every blood as infectious. Question 16. Which disease is spread primarily through droplets? Droplets is different from airborne. Droplets is like let's say you carry water and you sprinkle it. That's droplets. You know, when the water is dropping, you'll be seeing it. So it's different from airborne. Airborne, they are tiny, tiny particles like vapor. Most times you cannot see airborne, but sometimes you can see droplets. So the one that spreads through droplets, they say it's measles. A. Measles. B. Influenza. C. Tetanus. D. HIV infection. HIV infection. B is the answer. Infectious influenza is like all those common cold, all those whooping cough. They are all through droplets. They are all through droplets. Measles is airborne. That's airborne. Like I said, the vapor is measles, airborne vapor. Tetanus, they live in the soil, so that one is actually contact. HIV is spread through blood contact. HIV, sexually transmitted through contact. So the one that is through droplets, influenza is droplets. Whooping cough is droplets. Measles, pneumonia, they are airborne because their own is vapor that you cannot see. Like steam, you cannot see it. But droplets through cough. Somebody cough now. Most times you can even see the particles on the ground. If they cough on a table, you can see the particles on a table. So those spread through droplets is influenza. Number 17. What is the purpose of disinfecting equipment? Why do you disinfect equipment? You disinfect equipment to reduce or to eliminate microorganisms. That's why you disinfect them. So the answer is obvious. B. They say destroy all microorganisms, including their spores. Disinfection. Disinfection does not it does not like eliminate the spores. It can kill them. That's why the answer is B. Reduce or eliminates. It can kill them, it can reduce them, but it cannot kill or destroy the spores. That's why we are not picking A. If they say autoclaving now, we'll pick A. Because it will not just destroy them, it will destroy their spores too. But when they say disinfectant, it's like using disinfectant, like using Purits, using Dettol, etc. You can reduce it, you can kill some microorganisms themselves, but you cannot kill their spores. So that's why the answer is B, disinfection. Please always note that keyword. It's very important. If you feel disinfection can kill all microorganisms, what about the spores? It cannot kill the spores. So that's why you should not pick A. Instead, you should pick B. Anything that can destroy microorganisms and also destroy the spore is surgical, is autoclaving. Put that in the back of your mind. Autoclaving is the one that can kill the bacteria and destroy their spores. But disinfection, normal medical cleaning, boiling, and etc. can kill them, but it cannot destroy their spores. Next question. Which is an example of a portal of entry under the link of chain of infection? Portal of entry. Portal of entry is the fifth link after mode of transmission. There's portal of exit. Portal of exit is the third one. That means how do they leave their reservoir? Then this one, portal of entry. How would they enter the susceptible host? A, broken skin. B, hospital bed. C, stethoscope. D, gloves. B, C, and D. B, C, and D can be reservoir. B, they can stay in the hospital bed. That's when they leave when they leave their house, their reservoir. When they leave their reservoir, they can stay in your stethoscope. They can stay in your glove. You can transmit it through your stethoscope and your glove. The bed can actually be a reservoir, and that bed can also be a mode of transmission. But stethoscope and the glove is mode of transmission. How you move this thing. Somebody can sneeze on the stethoscope now. Sneezing is portal of exit. The microorganism will now stay on the stethoscope. When you now carry the stethoscope and you move it around, let's say you are not wearing hand glove, or you were wearing hand glove when you went to go and do the blood pressure. The stethoscope is on the hand glove now. It's on the microorganism is on the stethoscope because patient sneezed on the stethoscope. So when you got to your nursing station, you kept the stethoscope on the table. You pulled off your glove, you kept the glove, or you discarded the glove, then you pick up the stethoscope with your bare hand. Later, let's say you feel like cleaning your face, or you feel like touching your face, or some people that used to pick their nose, you feel like picking your nose, you just put it inside. So stethoscope and glove, they are modes of transmission. Hospital bed could be a mode of transmission. It could also be a reservoir because some of them can actually harbor themselves in that place. So portal of entry is broken skin, nose, eye, mouth, etc. Next question, question 19. He said a nurse accidentally sustained a needle prick injury. What should the nurse do first? You know, they say treat all patients as potentially infectious. So when you come in contact with let's say needle prick injury, the first thing you should do is you wash your hand immediately. Don't press it. Don't press it like this. Don't press it, the blood out. Don't press it. Just take it straight under running tap. Wet it, then put soap. Start washing. Just start washing it immediately. Just wash under running water. Don't press it. Just wash it. So that's what you do to needle prick injury. Wash with soap and water under running tap. Next question, question 20. It said, who is responsible for infection prevention and control? Everybody. Everybody. everybody in that hospital, not just doctors, nurses, every healthcare worker is responsible for IPC. It's not a job that you leave for one person. Because if you leave it for one person, what about the other person? The other person will still use it to come and infect you. So everybody must be responsible for that. 21. Standard precaution should be applied to all patients. We said it before. Standard precaution said treat all patients, all body fluid, all blood as potentially infectious. So standard precaution should be applied to everybody, all the patients. All the patients. 22. Which PPE protects the eyes from splashes? PPE, personal protective equipment, from splashes. So you can say if you use face masks now, it can splash to your eye. If you use goggles, it can splash to your eye. If you use goggles, protect your eye, it can splash to other places. They say it protects the eye from splashes. So anything that protects the eye itself is goggle. Face shield protects your face completely. So they say because they put goggles / face shield, you choose B. But in a situation where they say goggles as B, then C, they not say face shield, you should choose goggle. Why? Because they say eyes. Apron for body, gloves for hand, cap for head, goggles for eyes. Face shield does not just cover your eyes, covers your nose, also covers your mouth. So face shield can save you from splashes that can enter your eye, your nose, and your mouth. So in situation where they say eyes and they say option A, apron, B, goggles, they now say C, face shield. Pick B, goggles. But if they join goggles and face shield together, pick that goggles and face shield. But if they separate them and they say eyes only, please pick goggles. Face shield does not only protect the eyes, can protect your nose and your mouth, your face safe completely. So the answer to this question is B, which is goggles and or face shield. The correct container for use sharps, you should know, safety box, and they are always white, or they can say translucent, but it's mostly white. So sharps are for safety box. 24. To prevent needle prick injury, what should the nurse do? Excuse. To prevent needle prick injury, what must you do? Recap needles. Don't recap. If you recap needles, you prick your hand. See, say break needles. You don't break needles. You don't bend needles. You don't bend it. You don't break it. You don't recap it. Once you just bring it out from the patient, you're supposed to put it straight into the safety box. But because of hospital management, many people will still pull it out and then put only the needle inside. That's how it should be. But most times, as you are trying to pull out, you don't know, sometimes you are so busy that we are not careful enough. But any sharp should go inside the safety box immediately. So disposing of needles immediately in a sharp box. That is how you can prevent needle prick injuries. 25. Alcohol-based hand rub is appropriate when alcohol-based hand wash or hand rub is appropriate when they say hands are visibly dirty. If your hand is visibly dirty, you wash your hand. You don't use alcohol-based hand sanitizer. You don't use sanitizer when your hand is dirty. After using the toilet, you don't use sanitizer, you wash your hands. After handling chemicals, you don't use sanitizer, you wash your hand with soap and water. When your hands are not visibly soiled, that's when you use hand sanitizer. You don't just use it when your hand is dirty. If there is a place for hand washing, wash your hand. wash your hand. It's better than hand sanitizer, because most times you will not even know if the hand has touched something on the bed. When you assess it and you see that, okay, it's not soiled though. They said visibly means you can see that, oh, it's not soiled, it's not dirty. Okay, I can use hand sanitizer. That's alcohol-based hand sanitizer. Then when you see that it's dirty, please wash your hand. Question 26. Which infection requires contact? Contact precaution. B. Clostridium difficile infection. They are the ones that need contact. You know, pulmonary is airborne. Airborne precaution. Measles, airborne precaution. The same thing too. So, B is the answer. Clostridium difficile infection. You need contact precaution. When I say contact, like person to person. So you need to prevent that. That's for number 26. All right. Number 27. They say the ideal isolation room for TB. We've said it before. TB. That you need isolation, airborne isolation. They now say, what is the ideal isolation room? They are talking about the pressure that you need. Is it positive pressure? Is it negative pressure? Is it the ones that you block all the windows? Or the one that you do shared ventilation? Isolation rooms are naturally, they are either positive or negative. Positive pressure, negative pressure is the same thing like when you breathe. This is our normal breathing now. We are using negative pressure. But those that they put on ventilator, they are using positive pressure. So what's the difference between negative pressure and positive pressure rooms? This is a room. A patient is inside. And they say this room has negative pressure. It means the pressure in that room is low. Because this pressure is low, air from inside that room cannot go outside. But air from outside can come in. So air inside this room will not go outside, which means the germs inside this room will not go outside. That's negative pressure. It's used for TB. They use it for TB so that all the mycobacterium will stay inside the room. That's negative pressure. But when you are doing protective isolation, you use positive pressure. Positive pressure for protective isolation. So if this is the room and there is positive pressure inside, it means the pressure is high inside the room. Because this pressure is high inside the room, the pressure, the air will be going out. Once you open the door, the air will just push out. Meaning anything standing on the door will push it out. And nothing can come in. Why? Because it's very, very high inside. That's positive pressure. Means you are protecting this patient inside. You don't want anything from outside to come inside. But negative pressure, the patient inside, you are protecting others from outside. You are protecting those outside. Not the patient. The patient inside, you are protecting those outside. So negative pressure room, the pressure is low. The germ stays inside the room. When you open the door, air from outside comes inside the room, but air from inside cannot go outside. Positive pressure, inside the room, the pressure is high. When you open the door, pressure from inside the room go outside, but outside cannot come in. So that's the difference between negative pressure, positive pressure. Negative pressure room, pressure inside the room is low. Air inside the room cannot go out, but the one outside can come in. Positive pressure, pressure inside the room is high. Air inside cannot come in, but the air outside cannot come in, but the one inside can go out. Next question. They say the main purpose of PPE is to what? Is to protect everybody. It's also the main purpose of IPC, to protect everybody against infection. Before hand washing, the nurse should remove what? Anything you are wearing, you should remove, including ring. We know many of us still used to wear jewelry. They'll say because it's a wedding ring. But naturally, you're not even supposed to wear anything. All those people that are going to theater, they used to remove their ring. Those you are going to theater, they remove earring, remove everything. The surgeons, the scrub nurse, they remove it before you scrub. Even when you are wearing wedding ring, you don't want to remove it, because if you remove it, I don't know what will happen. You must remove it. when you are doing scrubbing and the rest. You are putting on glove, so you must remove it. So you remove your hand, your jewelry, and every other thing on your hands before you do hand hygiene. 30. Soiled linen should be what? Be shaken, you don't shake. Held away from the body, that's you hold it and you move it away from your body. That's the answer. You don't change patient's bed and then you just hold it close to your body. Microorganism will just from that place and just enter your body, enter all your clothes. So when you carry soiled linen and you don't have a soiled linen bin, that's why you are going to do bed making or changing bedspread. Carry soiled linen bin along. So once you just remove it, don't shake it, don't dust it. Just carry it and put inside the linen. If the linen is far for you, take it away from your body. Move. When you get to that place, put it. You're not seeing all these things. They give you microscope to see all these things. You will not even go to hospital again. So soiled linen should be held away from the body. 31. Disinfection aims to, we've seen this question before. Disinfectants is what they use. So disinfecting, disinfectant, disinfection, they are all the same thing. They reduces microorganism, they can kill microorganism, but they cannot destroy the spores. Next question says, which disease is spread mainly by airborne routes? Which disease is spread mainly by airborne routes? They are always saying airborne because airborne infections are very, very deadly. And secondly, they spread very fast. Very, very fast. Like COVID-19, airborne, spread very fast. And all these diseases that spread very fast, it's not easy to control them. So, which disease is spread by airborne? The answer is B, tuberculosis. We're talking about pulmonary tuberculosis since they are spread by airborne. Typhoid is fecal oral. Hepatitis A is fecal oral. Cholera is fecal oral. Fecal oral means, let's say the reservoir is human or animal. And then this human or animal carrying this microorganism, they poo. And somehow this poo gets to our food, gets to our water, gets to your utensils, gets to your hand, and you put it in the mouth. That is fecal, feces, oral, mouth. So typhoid, hepatitis A, cholera, they are all fecal oral. Tuberculosis is airborne. Next question. Hand washing should be performed when? Before and after contact of a patient. Before you do any procedure, you must wash your hand. After, you must wash your hand. So the answer is C. Before and after contact with patients. 34. Healthcare associated infection. We said it. Healthcare associated infection, also called nosocomial infection, also called hospital acquired infection, is one that is acquired during healthcare. Before admission, no. It's during admission. Inherited, no. Always viral, no. It can be bacteria, it can be fungi, it can be any of the microorganisms. But it is acquired during healthcare, means during your stay in hospital, during admission. That's when you acquire healthcare-associated infection or hospital-acquired infection or nosocomial infection. So your answer is B, acquired during healthcare. 35. Respiratory hygiene. When they say respiratory hygiene, talking about anything that has to do with your lungs, your nose, that's respiratory. Respiratory hygiene says covering cough and sneezes. That is it. B, sharing tissues. No, sharing tissues does not have anything to do with respiratory. Avoiding masks, ignoring cough ethics. You ignore cough ethics, it is. But A says cough and sneeze. That's why you are picking A. D is also bad. Ignoring cough ethics is bad respiratory hygiene. Bad respiratory hygiene. Avoiding masks is bad respiratory hygiene, mostly when there's airborne infection. Covering cough and sneeze, that's using of this your hand. When you want to sneeze, you do. When you want to cough, you do. If you have hanky, you can cough into it, you can sneeze into it. But when you do that, that one is infected. You're supposed to even throw it away, mostly when you are carrying infectious agents. So the answer to respiratory hygiene, covering your mouth. When you want to sneeze, cover your nose. When you want to cough, cover your nose, cover your mouth. That's good respiratory hygiene. 36. Sharp containers should be replaced when they are how many percentage full or When should you throw it away? When you should you keep it aside and bring a new safety box? Is B, 3/4 full. You see your safety box, divide it into 4. When the sharps have gotten to the third part, you discard. Don't allow it to get filled. Sharp box, safety box should not get filled to the 4th chamber. So 3/4 full is the highest for sharp containers. Next question, 37. Cleaning of patient care areas should begin with the cleanest area. Even normal mopping in the hospital, our janitors or our cleaners should always clean places that are clean first before you go to the dirty places. And the mop you use for cleaning the clean place is not the same mop you should use for cleaning the dirty place. For wound dressing, you should clean the place that is clean first before you go to the dirty area. Clean to dirty. So cleaning of patient care areas should be from clean area to dirty area. So cleanest area comes first to prevent cross-infection. 38. Which of the following is not a PPE? Which of these is not PPE? Stethoscope. Stethoscope, equipment for taking blood pressure. It is not a personal protective equipment. 39. After removing gloves, the nurse should do what? You must perform hand hygiene. I said it from the beginning. After removing everything, you must do hand hygiene. Before and after contact of patient, you must do hand hygiene. Hand hygiene is very, very effective. Very, very effective. Question 40. The ultimate goal of infection prevention is to reduce spread of infection, to protect the patient, etc. So your answer is B, to prevent the transmission of infection. That is the main and ultimate goal of infection prevention and control. So you follow us for more videos as the questions will continue using different subheadings. So these are assignments for you. Assignments, please try and do them. You should know what infection prevention and control is. Know the links of or the chains of infection. I've said it. State what WHO said concerning 5 movements for hand hygiene. There's what they call 5 movements for hand hygiene. When you touch a patient, when you touch their body fluid, etc. Try to know those 5 movements. They are very important. Differentiate between medical asepsis and surgical asepsis. You should know what all the medical asepsis is, all the surgical asepsis. Then explain the principles of standard precautions. When they say standard precautions, what does it mean and what are the standard precautions? So follow us for more video. Thank you.